The essence of good governance. The article emphasizes that good governance is not just about competent administration, but the sincere intent of rulers to serve the people. The crisis in Pakistan is attributed to corrupt and insincere governance, rather than merely a lack of competence. Failed leadership and state failure. Pakistan is on the verge of becoming a failed state due to the ruling elite's lack of priority in preventing state failure. Good governance requires the intent to genuinely improve the people's lives, something that is missing in the current leadership. Violation of democratic principles. The writer criticizes the manipulation of the 2024 election results, where the people's choice was overridden by a constitutionally subordinate institution. This has led to a government that represents the power that installed it, not the people. Need for radical reforms. The article argues for radical political, social, and economic reforms in Pakistan. This includes rule of law, meritocracy, progressive taxation, land and industrial reforms, and reducing military budgets to make room for development. Good governance is essential for national survival. Struggle for good governance. Good governance cannot be achieved through mere protests or questioning. It requires a sustained struggle by an informed, organized population, supported by leaders committed to radical reform and democracy. Elite betrayal and consequences. The ruling elites are accused of betraying the people by dismantling democratic governance and constitutional processes. The writer warns that if the elites do not search their conscience and desist, revolution may become inevitable. Crux. Good governance in Pakistan is hindered by corrupt, insincere leadership and elite betrayal. The nation requires radical reforms and genuine leadership committed to the people's welfare to avoid state failure. If the elites continue to dismantle democracy, revolution may be the only path forward. States' role in health. The article emphasizes that healthcare is a fundamental human right, and it is the state's responsibility to ensure adequate health and social measures. While governments should be stewards of the health sector, they don't have exclusive responsibility for health service provision. Challenges in public health care. Most low- and middle-income countries, LMICs, including Pakistan, underinvest in healthcare, particularly in primary healthcare, PHC, which is crucial for cost-effective disease prevention and early management. Instead, governments spend more on tertiary care, leading to insufficient and low-quality public healthcare services. Growth of private healthcare. Due to inadequate public healthcare services, a private healthcare sector has evolved, driven by market demand and weak regulatory oversight. In Pakistan, around 60% of total healthcare expenditure is out of pocket in the private sector, with 70% of outpatient consultations occurring there. Public-private partnerships, PPPs. To improve healthcare accessibility and quality, governments are increasingly partnering with the private sector. PPPs allow both sectors to collaborate, especially in underserved areas, without absolving the state of its responsibility. Examples of PPP success in Pakistan. Indus Hospital and Health Network, IHHN, manages a large hospital in South Punjab, offering free healthcare to 30,000 patients monthly. This partnership demonstrates how the private sector can help improve public healthcare services. Childlife Foundation provides emergency pediatric care across Pakistan, ensuring access to critical services for 80% of the population at no cost. Sehat Sahulat Program, a state-financed health insurance initiative that partners with 1-200 private hospitals to provide predefined health services to citizens. The future of healthcare. PPPs are emerging as a sustainable solution to advancing universal health coverage, UHC, and LMICs. Properly managed, they can expand access to quality healthcare and strengthen the state's stewardship of the health sector. Crux. Governments in LMICs, including Pakistan, face challenges in providing adequate public health care. Public-private partnerships, PPPs, are a growing trend that allows the private sector to complement public health care efforts. Through well-managed PPPs, healthcare access and quality can improve, driving progress toward universal health coverage, UHC. Historical precedent and judicial struggles. The article opens with a reflection on the emotional toll of significant judicial cases, highlighting Federation versus Tamazuddin, which set the stage for derailing democracy in Pakistan and aligning the judiciary with the executive's interests. Since then, the judiciary has often struggled for independence, with cases like Bhutto's constitutional amendments, Zia's PCO, and the Dogar courts under Musharraf, marking moments where the judiciary was compromised. 26th Amendment, a new assault. The recently leaked 26th Amendment is described as an unprecedented attack on the Constitution and judicial independence. It is seen as the most destructive solution yet in Pakistan's 77-year history, with many critics likening it to a neo-PCO aimed at undermining the Supreme Court's autonomy. Creation of a new federal constitutional court, FCC. One of the most controversial aspects of the amendment is the proposal to strip the Supreme Court of its constitutional interpretation duties, transferring them to a newly created federal constitutional court. This move is seen as reducing the Supreme Court to handling civil and land disputes, while the FCC becomes the government's tool to control constitutional rulings. Undermining judicial independence. The amendment proposes allowing MNAs, dominated by ruling parties, to select the Chief Justice, reversing gains made for independent appointments. High Court judges could be transferred between provinces, weakening their independence and integrity. The FCC's Chief Justice would be handpicked by the Prime Minister, further politicizing the judiciary. Potential erosion of legal precedent. Pakistan's legal system relies on the common law tradition of constitutional interpretation. The establishment of the FCC mimics civil law countries like France or Germany, which is foreign to Pakistan's legal framework, potentially disrupting hundreds of years of legal precedent. Undermining fundamental rights. There are fears that Article 8, which protects fundamental rights, could be weakened under this amendment. Senator Kamran Murtaza of the JUIF has already voiced opposition to a draft that could water down this crucial protection. Endgame of the amendment. The article argues that the proposed changes in the 26th Amendment will destroy judicial independence, turning the judiciary into a subordinate branch of the executive. The Chief Justice's extension, as part of this amendment, is also seen as futile given the imminent succession of Justice Syed Mansoor Ali Shah. Crux. The proposed 26th Amendment poses a severe threat to Pakistan's judicial independence by creating a government-controlled federal constitutional court, stripping the Supreme Court of its core functions and undermining the Constitution. The judiciary's integrity is at stake, and critics argue that this amendment must not stand. Montessori philosophy. The article begins by commemorating Dr. Maria Montessori's birthday, highlighting her contributions to education. It emphasizes the Montessori philosophy, which advocates that education is a natural process, led by the child's own exploration of their environment, not simply delivered by a teacher. The child is a self-constructor. According to Montessori, children are active participants in their own development, constructing themselves through experiences. The teacher's role is to facilitate this by preparing an environment that allows the child to learn autonomously, respecting their unique tendencies and instincts. Critique of traditional education. The article critiques traditional school systems for causing deviations by imposing too much control and discipline, which stifles children's natural curiosity and self-learning instincts. Such systems focus on uniformity and competitiveness, which undermines a child's innate interest in learning. The importance of following the child. The principle of follow the child, often repeated by educator Farida Akbar, is central to Montessori's method. It suggests that children should be given the freedom to explore their interests without external pressure. The article advocates for adopting more child-friendly educational approaches, especially during early childhood. A Montessori experiment. The author recounts their own experiment with a group of 10 low-income children, guided by the Montessori method. In this Ao Kailine Markaz, Come Let's Play Center, the children were allowed to choose activities they were interested in without being forced or rewarded. The focus was on letting the children work at their own pace in a well-prepared environment, with guidance from experienced educator Hawa Mohammed and mentorship from Farida Akbar. Results of the Montessori approach. The experiment showed remarkable results. The children quickly adapted to their environment, developed strong concentration, and showed interest in reading and working without external prompts. They became articulate in their native language, Urdu, and learned to recognize their names. Their sense of accomplishment came from within, rather than from competition or rewards. Flaws in the current system. The article concludes by criticizing the current education system for pushing children too hard, fostering competition, and producing adults who are overly ambitious, greedy, and willing to compromise ethics. It argues that children should be allowed more time and freedom to develop naturally, which would lead to a more diverse and balanced society. Crux. The article champions the Montessori philosophy of child-led learning, criticizing conventional education systems for imposing too much control and competition on children. By giving children freedom to explore in a carefully prepared environment, the Montessori method fosters curiosity, concentration, and a deeper sense of satisfaction, allowing ECP's defiance of the Supreme Court. The Election Commission of Pakistan, ECP, is showing resistance towards obeying the Supreme Court's ruling in the reserved seats case. Despite being cautioned by the court, the ECP has sought additional legal opinions instead of implementing the decision promptly. Political support for ECP. The federal government, particularly through the Speaker of the National Assembly, is providing political backing to the ECP. The Speaker has informed the ECP that a new law passed in Parliament prevents the enforcement of the Supreme Court's order regarding the reserved seats. Pattern of defiance. This is not the first time the ECP has ignored court orders. Last year, it refused to hold elections to the Punjab Assembly as mandated by the Supreme Court, with support from the PDM government. This pattern of defiance continues to manifest in various cases involving the judiciary and the ECP. Potential clash between institutions. The article warns of a growing conflict between state institutions, particularly between the judiciary and the executive, as a result of the ECP's actions. This confrontation undermines the constitutional principle of the separation of powers. Tailor-made legislation. The government's tactic of using new legislation passed after a court verdict to bypass judicial decisions is seen as a direct challenge to the authority of the courts. The National Assembly Speaker's role in endorsing the ECP's position exacerbates this defiance. Risk to democratic principles. The article expresses concern that the government, despite claiming to uphold democratic ideals, is engaging in actions that erode core democratic values. The reliance on tailored laws to avoid implementing court decisions is portrayed as a dangerous precedent. Need for institutional boundaries. The article concludes by urging all state institutions to respect their constitutional boundaries. It warns that overstepping these limits will lead to further deterioration of democratic principles in Pakistan. Crux. The ongoing defiance of the Election Commission of Pakistan against the Supreme Court, supported by the federal government, threatens to escalate into a major institutional clash. The article highlights the risk this poses to the separation of powers and the erosion of democratic values, urging all institutions to respect their constitutional mandates to prevent further damage to Pakistan's democracy. Elections in Indian-held Kashmir, IHK. India is holding multi-stage elections in IHK, marking the first such event since the region's limited autonomy was revoked in 2019. While the elections are being promoted as a sign of normalcy, the situation remains far more complicated. Motivation behind voting. Although voter turnout has been relatively high, it is not necessarily a sign of support for the BJP government. Many Kashmiris are voting to prevent the BJP from further encroaching on their land and identity. There may also be a protest vote against the removal of Article 370, which previously granted IHK special status. Unfair conditions. The polls are not being held under free and fair conditions. Prominent local leaders, including Omar Abdullah, describe the region as politically oppressed. Amnesty International has criticized New Delhi for its harassment and intimidation of dissenting voices, and thousands of Kashmiris remain in detention, some on dubious charges, indicating a lack of true democratic freedom. Persistent discontent. The elections do not reflect the ground reality, as the people of Kashmir continue to resent India's heavy-handed policies and aspire for genuine freedom. Many voters are using the elections as a means to express their dissatisfaction with the status quo. India's stubbornness. India's ruling elite, particularly its foreign minister, have signaled that the Kashmir issue is settled with the abrogation of Article 370, ignoring international concerns and the wishes of the Kashmiri people. This stance is seen as an attempt to create new facts on the ground. Need for a tripartite agreement. The article concludes that the only lasting solution to the Kashmir conflict is a tripartite agreement involving Pakistan, India, and the Kashmiri people. Any solution that excludes one of these parties would be illusory and fail to address the core issues. Crux. Despite India's portrayal of elections in Indian-held Kashmir as a step toward normalcy, the region remains mired in discontent due to New Delhi's oppressive policies. Kashmiris are voting not in support of the Indian government, but to express their dissatisfaction and protect their identity. A lasting solution to the Kashmir issue requires a tripartite agreement involving Pakistan, India, and the Kashmiris, as anything less would ignore the region's complex realities. Need for scientific temperament. Deceased organ donation in Pakistan requires a more scientific and informed approach, both at the public and policy levels, to flourish as a common practice. Prime Minister's initiative. Prime Minister Shehbaz Sharif's recent launch of a national program promoting organ donation, including a special donor logo on identity cards, is a positive step towards creating awareness. Lack of public awareness. Despite being charitable, Pakistanis are generally unreceptive to cadaveric organ donation due to a lack of information. Public and religious endorsements, such as from countries like Iran and Saudi Arabia, which allow such transplants, could help reduce doubts. Black market for organs. The rejection of organ donation has fueled the illegal organ trade, where vulnerable populations are exploited for the benefit of wealthier patients. Challenges in organ preservation. Even when organs are available from deceased donors, delays and a lack of proper medical infrastructure can render them unusable. Organs decay quickly after death unless proper life support measures are in place, especially for the timely transport of organs to recipients. Legislative and logistical needs. The government should invest in better transportation for organs, build hospitals in remote areas, and minimize financial corruption to ensure the system works efficiently. Convincing families. Once the deceased donor's criteria are met, it is crucial to convince families to respect and honor their loved one's decision to donate their organs. Crux. Deceased organ donation needs to become a mainstream practice in Pakistan, supported by public awareness campaigns and government initiatives. While Prime Minister Shehbaz Sharif's recent program is a step forward, further efforts are required to change societal attitudes, combat the illegal organ trade, and ensure the timely preservation and transportation of donated organs. A robust legislative and medical infrastructure, combined with family cooperation, can make organ donation a life-saving reality in Pakistan.